Hello everyone. We are discussing various X-rays under the topic reflection. How the anatomical landmarks reflect on these X-rays we are discussing. This is Professor Dr. Prashant Busari welcomes you on this emerging MEDTALK. Topic is on chest X-ray, difference between posterior anterior and anterior posterior view. So here we can have very commonly posterior anterior view. It is a normal standard projection and it is in the full inspiration, and it is taken in the standing position, and X-ray beam traverses from posterior to anterior side. So this is X-ray tube, and we can see how this X-ray passes from posterior to anterior side, and film cassette is placed in front of the patient. So this is posterior anterior view. We can see this is posterior anterior view. Then second is anterior posterior view. It is opposite. Here the direction of X-rays is from anterior to posterior side, and where particularly in the sick intubated patient, it difficult for the standing. So in this condition, anterior posterior view we do. So here is X-ray tube, and we can see how the X-ray beam ray passes from anterior to posterior side, and cassette is placed behind the patient. So this is where the this clavicle placed horizontally, anterior posterior view. So 10 different tips or the different points we can see. So here is this the posterior anterior view. So position of patient, X-ray passes from posterior to anterior. Here from anterior to posterior side, distance is around 6 feet in between patient and the tube. Here distance is 4 feet. So next, clavicle in this posterior anterior, it is somewhat S shape and obliquely placed. In this AP view, there is a straight horizontally placed, we can say, the clavicle. Scapulae in the posterior anterior, it is out of the field, and in this anterior posterior, it is most of the lung field may occupy. Then the ribs particularly, it is placed somewhat obliquely. So we can say this obliquely place these ribs, and in this AP view, this is placed horizontally. Then the vertebral bodies up to the fourth thoracic, these thoracic vertebra clearly seen, and below will be the barely visible. Here all they are visible on this AP view. Then mediastinum and heart, it on this and PA view, it is normally appears as it is. We can measure and decide the cardiomegaly also, but in the AP view there is a, we can see the appears enlarged or magnified on this AP view. So the bronchiovascular markings, particularly in the PA, it is more common in the lower lung zones, and in anterior posterior view, it is distributed throughout the equally in the whole lung zone. Then fundus of the stomach position, in the PA view, it is normally situated just below the left dome of diaphragm. It is erect position, standard position, and but in the anterior posterior view, we can't see the this position of the gas shadow. Then position of the, we can say, the lung field or lung parenchyma, it is well defined, but in the AP view it is less well defined because of the this scapula also, and magnified image of the these, we can see the this heart or the mediastinum also. Then diaphragm in the PA view, it is at around 5 to 6 intercostal space or the rib, and in on the AP view it is elevated. So most common we are doing is the posterior anterior view, and in sick or intubated patients is the anterior posterior view less common. And these are the 10 differentiating points between posterior anterior and anterior posterior views. I hope you like this. If you have any suggestions, please add on in the comment box, and for further videos you can subscribe this emerging MEDTALK. So thank you.